Even though having surgery can be frightening, there may be numerous precautions and steps that must be done to guarantee the patient's full recovery, depending on the treatment. It takes a leap of faith to have faith in the medical team, from the nurses to the doctors to the surgeons themselves. Surgery may not be as dramatic as it appears on television, but learning after you've already had stitches put in that something is within your body that shouldn't be isn't what you want to hear.
Hello everyone. Welcome to AWZ. Don't forget to subscribe our channel.
The gloves are removed. One French woman's issues were meant to be resolved after surgery to stop her painful periods. She had the novel surgery in April 2017 in hopes that it might help her stop menstruating without undergoing a full hysterectomy. 2. She was assured that she wouldn't have any more bleeding or discomfort once the procedure was finished. The woman was informed that the procedure went smoothly and that there were no difficulties, yet she did not experience any sort of relief. She went in for surgery because of pain in her bottom abdomen, which returned after the procedure. She had trouble sleeping because of this agony, and she was always sick. She called her doctor when she could take it no longer, and he or she prescribed painkillers and blamed it on her weight. However, the discomfort persisted. Mrs. Birch started to think it was her catheter, but a trip to the restroom disproved her theory. She was in the bathroom when she felt pressure in addition to pain, and she let out a surgical glove. Although there was no damage, the event itself was allegedly scary enough. In a haystack, a needle. The proverb "finding a needle in a haystack" refers to searching for something that is difficult to locate. The proverb applies to a Tennessee man who passed away in May 2017 after doctors accidentally left a needle inside of him. When John Burns Johnson's surgeon noticed he was missing a needle, he had just finished a 9-hour heart operation. A second procedure was performed after an X-ray confirmed that the needle was still remaining inside Mr. Johnson. Although it's unclear whether the needle couldn't be detected or taken out, it nonetheless managed to stay inside Mr. Johnson. Sadly, Mr. Johnson went dead a month later as a result of difficulties brought on by the needle's stay in his body. He had an autopsy, and the needle was discovered and taken out. Throw the towel in. The undesirable side effect of surgery is bleeding, and employing sponges to stop the blood from spreading is standard procedure. On the other hand, leaving the sponge inside the patient is not. Unknown stomach bloating plagued a woman in Japan for 3 years, intermittently. She visited the doctor in an effort to identify the problem, but test results showed that she actually had 2 sponges inside her abdomen. The sponges, which had attached themselves to the wrinkles separating her abdominal and stomach as well as her colon, were thought to have been left behind after her cesarean section 6 years earlier. Although the surgery gave her the much-needed respite, leaving sponges within patients is not uncommon. Sponge objects make up around 70% of the items discovered inside patients, and they have the potential to be fatal. Nearly 2/3 of instances in which objects like sponges were left within patients resulted in severe infection, harm, or even death. Not wire? A frequent surgical tool, wires may need to be retained inside the body depending on the treatment. However, following a routine procedure in August 2018, a wire was left behind in the case of a patient in England. It took 12 hours before the missing wire was reported. Fortunately, the patient experienced no negative side effects, and a subsequent procedure was planned to remove it. Donald Gable experienced a heartbreaking situation such to this one in Philadelphia. Gable felt great when he went home following his heart surgery. He didn't learn that a 0.6 meter, 2-foot, wire had been lodged in his chest for 6 weeks until a checkup with his doctors. Fortunately, the wire could be removed, but, considering its perilous situation, Mr. Gable was fortunate it didn't enter a vein. Doctors frequently utilize wires to help direct equipment where they need to be. During surgeries at the Albany Medical Center, 2 wires were left inside of the patients. During a catheter procedure, a single wire had been employed for directing. Doctors weren't able to find and remove it until after the patient got an X-ray. Rock, paper, scissors, or both. It happens almost too frequently for parents to have to tell their kids to use caution when using scissors when they are young. The surgeon for an Australian woman should have received the same caution. Pat Skinner, 69, underwent surgery to remove a portion of her colon in 2001. She suffered pain after the procedure, but was told to expect it given the nature of the procedure. Mrs. Skinner didn't believe the surgery was the source of the discomfort, despite the doctor's claims to the contrary. This ache was significantly worse than the uneasy sensation the physicians had warned her about. Mrs. Skinner was right, it turned out. Her general practitioner discovered that during her surgery, 18 centimeter, 7-in, scissors had been left inside of her. The most of her agonizing discomfort was coming from the scissors, which had gotten stuck up against her tailbone. Unfortunately, by the time the scissors were discovered, tissue had already started to grow around them, necessitating a more involved procedure that required the removal of part of her bowels. Should I or shouldn't I scallop? It is startling when a surgeon loses stated tools inside their patient, because a surgeon can only be as good as their hands and their equipment. An Army veteran who had his prostate surgically removed in 2013 after being diagnosed with cancer experienced this surprise. Mr. Glenford Turner was not informed of any issues or given any cues that anything wasn't right when the procedure took longer than anticipated. Despite the doctor's assurances that the discomfort would subside, it did not. Due to persistent abdominal pain, Mr. Turner saw his doctor again after 4 years. Instead of a tumor, they discovered a strange item. It was determined that the scalpel, seen above, was from his prior surgery and had been left inside him. It had been traveling between his bladder and rectal area and was the main source of his agony. Thankfully, the scalpel could be taken out. This contrasts with Victor Hutchison, who was hospitalized after having symptoms he initially believed to be gallbladder related. It became clear after he underwent an X-ray that his gallbladder was not the issue. Mr. Hutchinson underwent heart bypass surgery months ago, but the scalpel used during the treatment was missing. Although personnel were aware of the missing scalpel, they were unable to locate it and used an X-ray to search Mr. Hutchinson's chest without success. The surgical team was unaware that the scalpel had exited the chest cavity and was now trapped in Mr. Hutchinson's abdomen cavity near his spine. The physicians decided that the scalpel was in a dangerous position and couldn't be removed after it was discovered during his following X-ray. It's unlikely that Mr. Hutchinson decided to save this surgical keepsake out of all the ones to keep. The kitchen sink and everything else. Even if many of these situations sound alarming, nothing is more alarming than a man who has cancer surgery and emerges from the procedure with 16 new issues. Those issues? Items used during surgery that were left inside of him. 2009's operation on Dirk Schroeder was expected to be a simple procedure with minimal side effects. Mr. Schroeder's postoperative experience was the exact opposite. Mr. Schroeder endured pain, weariness, discomfort, and illness following his procedure. However, according to his physicians, everything was to be expected as part of his recuperation. That is, until his home health aide saw a gauze pad emerging from Mr. Schroeder's stitches, where it wasn't supposed to be. 16 medical instruments, including swabs, a 15 centimeter, 6-in, roll of gauze, a compress, needles, and other tools, including a portion of a surgical mask, were discovered in his body after the surgery. These instruments had been preventing his body from healing properly. Every year, approximately 1,500 individuals have objects left inside of them after surgery. Gauze to substantial tools are among them, however it is uncommon for more than one object to be left inside a patient. To remove the 16 things from Mr. Schroeder's body, whether whole or in pieces, required 2 additional procedures. The question that both Mr. Schroeder's family and everyone else would like to have answered is how the personnel did not discover a significant number of their tools missing after the procedure. This is all for today. Subscribe our channel for more videos.